Hello and welcome to this edition of Kids Spaces, the show that's all about you and your space, your home and surroundings, and how they relate to your kids. I'm Debbie Marie.
And I'm David Jones. Today we're in the school library because the kids are already back to school, but it's here where they learn about all the subjects that spark their interest. You know, learning is a good thing.
It is, and it's fun, but not just for the kids. It's also for the parents. And you're going to be surprised on today's show how you can discover a lot of things that could be called a learning experience.
That's right. We're going to learn about testing for the flu, planning meals for the entire family, and getting the little ones the nutrition that they need.
And we have fashion for the girls, and we're going to show how to get the kids in a bathtub.
All right, that's more of a magic trick.
So stick around and see it all right here on Kids Spaces. When our kids have a bad respiratory illness, we're left wondering what's the cause. A cold, the flu, or an RSV infection.
But now a trip to the pediatrician's office can reveal the answer and the treatment right there on the spot. Here's Kelly Lightbourne in Brandon, Florida with the story.
When children come down with a fever and respiratory ailments, mothers are often left guessing what could be wrong. Is it a common cold, RSV, or the flu? So how do they find out what's infecting the child? And what should be done to ease the little one from suffering? Kids Spaces is here at Nadal Pediatrics with the expert Dr. Frank Nadal to learn how parents can have the peace of mind they need when they have a sick child. Thanks again for joining us.
Well, thank you very much. Today we're here to talk a little bit about influenza, RSV, and the common cold, and how it affects kids in America.
Well, it doesn't sound like it's a very good mix. So how does the flu and RSV affect a younger child?
Well, they can be mild at times, but sometimes this could be quite sickening, and children do at times require a visit to their pediatrician as well as treatment.
So how serious is the flu or RSV to a younger child?
Well, most of the time the flu is not a severe illness. It will make the child be slightly ill and not require much, but essentially a lot of the times we do need these children be seen because it could be quite serious.
Okay, so as a parent, I think the big question is, if I have a sick child, when do I seek medical attention?
Well, if your child is having difficulty breathing, if your child is having difficulties eating, if your child is having high temperature, those are the times that I think you have to seek medical attention.
So how do you diagnose the flu or the RSV, and how do you know the difference between that and, say, a common cold?
Well, the flu and RSV can be quite similar. Usually RSV is seen in the smaller children. RSV, it stands for respiratory syncytial virus. RSV can attack smaller children and cause severe respiratory illness. It is a little bit different, and the treatment is quite different than that of influenza. So it's important to know the difference between RSV, influenza, and the common cold. For many years we did it on experience and essentially a little bit of a guessing game. But nowadays it is so easy. Both the influenza and the RSV test take just a few minutes to do. The Q-tips are introduced in the child's nose in both sides. It takes then a few minutes just to have our nurses run the test, after which it's very, very easy to come back to the parents and tell them, well, your child has RSV or your child has influenza, or both tests are negative and all you have is a common cold.
So it gives the parents a peace of mind.
A lot of peace of mind.
So how common is it to use a fast test?
We do hundreds of these tests in the winter months, and it's so easy and so fast, and the parents feel so much better once they know.
Well, I got to tell you, as a parent, there was a lot of great information. Thank you so much for coming on Kids Spaces. It really is important for parents to have a course of action should they see the symptoms of influenza-like illnesses. And diagnosis is fast, so proper medical attention can be administered with maximum effectiveness. For more information, visit our website at designingspaces.tv. I'm Kelly Lightbourne with Kids Spaces.
Okay, we learned a lot today on Kids Spaces. Let's see. We had nutrition and health, bath time and fashion.
And we never even had to open a book.
Well, you know what they say, not everything can be learned in a book.
That's right. You can see it on TV.
I don't think that's what they meant.
Yeah, it is.
No, it's not.
Yeah, it is.
Thank you for joining us on this edition of Kids Spaces. I'm Debbie Marie.
And I'm David Jones. Thanks for watching.
We'll see you next time.
We're
going to go reading now.
I'm gonna
not
look it up.
everything. No.
I'm going to look it up.
Can't be learned. You can visit these websites to learn more about the participants on this edition of Designing Spaces.